Jim.
I'm trying to take it easy. I brushed my teeth and I noticed the toothpaste tastes completely different. I know that this is my face leaving me. Hours later, at my
Good evening, everyone. We will get started in just a couple of minutes. If you could mute your mic if you're not already on mute, that would be really helpful.
The volume on our computer's down.
Okay, it is 6:30 and
Hey, Barb.
hi there. I'm Barbara Lee Van Horsen. I am the experimenter at the Momentum Center, which is a grassroots movement to create a stigma-free community. And one of the things we do is host town hall meetings on mental illness. And we had one scheduled that when the coronavirus pandemic began, we had to postpone. I was concerned about doing a town hall on an online basis because of the amount of interaction we do. So if you haven't been to one of our town halls before, they're not a typical town hall in that you just listen to people. We actually also engage in conversation with each other and then bring that feedback to the mental illness task force for additional discussion and action. So using the Zoom rooms, we hope to be able to accomplish that tonight. There should still be, we have 112 people signed up tonight, which is wonderful. I think many of them probably have not used Zoom before. And so I kind of expect people to log on as we go, but I don't want to wait to get started because we have so much to accomplish in a relatively short period of time. So I'm going to share my screen so that you can see these slides. And I want to offer some thanks, first of all, to our sponsors, who include Ottawa County, North Ottawa Community Health System, the City of Grand Haven, and Grand Haven Area Public Schools. It's because of their help that we are able to provide these community conversations. And a big thanks to my speakers, and we'll hear from them in a very short while, but Lynn Doyle from CMH, Brett Van Tol from Pine Rest, Lee Moordyke, Building Resilient Youth, Ben Ashnauda and Tim Gengel from North Ottawa Community Health, Jody Sprague from Spectrum Health, and Sarah Lewakowski from Mosaic. I'm very, very grateful. I have an incredible panel that we're going to be hearing from tonight. So how does this look? Our agenda for tonight is as follows. This welcome, I'll go over some instructions and we'll have a couple polling questions. And then I'm going to turn things over to the speakers. I have an order to ask everybody to speak in. I'll ask everyone to keep your microphones on mute. And then when it's your turn to speak, if you would unmute your mic, our speakers have 5 to 7 minutes. At 5 minutes, I am going to show this little warning, which means please wrap things up because again, we have a lot to cover and we're really working to fit about a 2.5-hour program in an 1.5 hours. So if everybody can be mindful of their times, that'll be really helpful. After the speakers talk, we'll do Q&A and then we'll do the breakout sessions, a couple of polling questions, and then talk about our next steps. So a couple instructions, as I said, please keep your microphone on mute unless you're asked to speak. I want to encourage you to submit your questions using the chat box. So at the bottom of your screen, if you're not familiar, if this is your first time on Zoom, there's a tab there for the chat box. You can type your questions in there, and Jenna, a wonderful volunteer, and staff member at the Momentum Center will be tracking those so that we can bring those to our panelists after they speak. If your question is for a particular person on the panel, please indicate that when you type in your question. If not, we'll just be randomly assigning them. And I do want to thank also, our speakers will be facilitators for the small group, but we also have other volunteer facilitators, including Callie Kaluza, Jessica Christopher, and Jenna Vipon from the Momentum Center. We have Lacey Lemke from North Ottawa, Rebecca Neal from Paradigm Wellness, and Angela Dersham from the OAISD also assisting in that role. So lots of thanks to you as well. When we do go into those breakout sessions, in order to participate, you do need to have downloaded the Zoom app. So if you want to participate in those, make sure you do have the Zoom app downloaded on either your computer or your phone. And then when this is all over, there will be next steps. We are recording the session. We'll have that recording available. As I said, the feedback that we get from the small groups will go to the mental illness task force so that they can talk and bring suggestions to improving our community's response to mental illness and COVID-19. And we'll also reply to any questions that we might run out of time to get to tonight. So if there are questions that get asked in the chat box that we can't get to, we will follow up with that. We have your emails. We can make sure that we get that material to everybody. We always have ground rules that we go over when we get together, and you'll be on mute while the speakers are speaking. But when you go into your small groups, it's a good time to keep the ground rules in mind. One is honesty. We don't get together to debate who's right and who's wrong, but to have an honest conversation about what we think and have experienced, and to be willing to listen to other people's experiences as well. We have an amazing panel speaking tonight, and we're very grateful for the expertise they bring, but we also recognize that we're all equal and valuable contributors to the conversation. We want to practice respect, recognizing that we all have preconceived ideas that can get in the way of our listening to each other. So we want to be aware of that so we can remain respectful at all times. We want to practice active listening. So instead of rushing to what we would like to say, to really give our attention to the person speaking. And that can be extra challenging in a technology format. So challenging us all to practice active listening. And then responsibility. We all have hot buttons and they can get triggered unintentionally. So if that happens, we want to claim responsibility for our feelings as well as our words, naming it without blaming anybody else for it. A reminder to please put your microphones on mute if you have not. And I might be able to control that here too and put people on mute if necessary. But with that, I do want to introduce a polling question too to start with. This first one is just, how is your own mental health right now? There should be a screen that flipped up, and just a general question, kind of normal amount of stress, or things are getting a little rougher, really struggling, or in crisis and needing resources. Or maybe you're fine and you're just worried about somebody else. So if you just indicate that, and this all reports anonymously, but it gives us kind of a feel for where the group is right now. And we have about 72% of the people have voted. We'll give it just a few more seconds. And we're about 83%. All right, I'm going to guess that's all who are going to respond to this one. So just to share those results with you, looks like most of the people on the call tonight are doing pretty well, and looking and really here to hear how to support the rest of the community. And then the next one is just about what particular areas of concern are most on your mind. Our conversation tonight is very broad in general in terms of mental illness and COVID-19, but what are the concerns within that maybe are causing you the most concern and worry? If you take a moment to answer that, and you can answer multiple for this one. And we'll leave that up just a few more seconds. Okay. So having somebody get sick appears to be the biggest concern that people are having, and some real even distribution among some other things. The economy in general looks like a second runner-up, isolation and loneliness coming in third. So we will definitely be addressing those concerns tonight. With that, I want to close this, stop sharing my screen, and introduce our first speaker. Now our speakers, if you do have slides that you want to show, please share those from your own screen. And we'll start with Lynn Doyle from Community Mental Health to kind of help share an overview. So Lynn, if you want to unmute your mic and take it from here.
All right, can you hear me all right? Uh-oh. Can you hear
Yeah,
me?
I can hear you, Lynn. Yep,
Awesome.
yep, it's good.
Sorry, I was having problems with my computer earlier today. So thank you so much for inviting me to be a part of this. I'm excited that there are so many people online that want to know about mental illness and how it relates to COVID-19. You know, if what we're trying to do in part is to reduce stigma around mental illness, then your spending time tonight learning about these things goes a long way in increasing your knowledge and understanding. And those are some of the best ways to fight stigma. So my name is Lynn Doyle. I am the executive director at Community Mental Health of Ottawa County. We provide treatment services to individuals with mental illness, developmental disabilities, and substance use disorders. We primarily serve people who have Medicaid or no insurance, but we are also a part of this community's safety net services, which means that we're in part responsible with a lot of other agencies and providers to make sure that everyone's mental health is taken care of. We provide services throughout the community, like our 24-hour crisis line. We provide referrals to other organizations that provide mental health treatment in the community. And we recently started a community navigator program that is really there to help people who aren't sure what they need, but they know they might need some mental health treatment, or someone they love might need mental health treatment and they don't know where to start. So we're here today to talk about why it's important to pay attention to mental health during this pandemic. And my part of this presentation is to let you know about some things that have changed with mental health and mental health treatment because of the pandemic. I'm happy to say that we, along with a lot of other mental health providers in this community, really stepped right up to the plate when the governor announced that her stay-at-home order, and really basically said most places are closed for business. Most community or most mental health treatment places went to providing services using telehealth. And so telehealth, in case you don't know what that is, a lot of people do because they've been using it in some way, shape, or form, either for their physical health or other needs. Telehealth really means that those things that we used to do that were face-to-face, like coming into an office and talking to a therapist, or coming in and talking to a psychiatrist or a case manager, those things are now being done via phone calls or emails or video conferencing like this, like Zoom, or Microsoft Teams is another one. There are actually a couple different platforms out there. So what that means is that, again, if you were used to having someone come out to your house, if you were getting case management, or if you were used to going into an office, those types of services can now happen virtually. And for the most part, I would say people think it's going pretty well. You know, we're having some real success in what used to be sometimes a 25% no-show rate, or people canceling their appointments, has really gone down now because it's easier to get a hold of people sometimes at home. Often people have transportation issues, or for a lot of the people we work with, it's just really hard for them to leave their homes. So in some ways, the telehealth has ended up being more successful, I think, than we originally thought it was going to be. Telehealth isn't the end all be all. There's certainly a place for face-to-face contact and paying attention to people's nonverbal behavior, that type of thing. If somebody's really anxious, or they haven't taken care of themselves, taken a shower or whatever it is, it's good to see that in person, to see how a person's mental health status is as well. There's also some difficulties with using telehealth. Often people don't have phone service, cell phone service, or computer access or internet. A lot of, we take that for granted sometimes that people do have that, but there are a lot of people in this community that don't have it, or they have real limited availability, limited minutes on their phone. So to use that up during a conference or a video conference is something that could be problematic for them. The other hard thing with telehealth is that it's hard to get privacy. So, we've done video conferencing with people, and they're literally sitting in their kid's bedroom with the door shut, trying to get some privacy. So that's another issue that is somewhat problematic for telehealth. And then there's some things you just simply can't do by phone or by teleconferencing, such as giving people injections for their medications and that type of thing. So when we do see people in person, because we are still occasionally going out into the community where people are coming on a very limited basis into our office, we are making sure that we are following safety precautions. So using masks, using distancing when we can do that, lots of hand sanitizer. I believe in the future, those things will be common practice, at least for the short term, even if we do resume face-to-face visits. I wouldn't be surprised if most places have those sneeze guards that the grocery stores are installing at their front desks, all in an effort to try to, not spread germs. So we, like most places, are anxiously awaiting when we can reopen safely. At CMH, even though the businesses might be opening fairly soon, cross your fingers, I would imagine we and a lot of other mental health providers are going to kind of take it slow. We understand that some of our folks have underlying physical health conditions, and we want to make sure that people are as safe as possible. So I know that we're going to probably use a combination of the telehealth services we've been using, as well as some face-to-face visit using those precautions. So the other thing I wanted to mention that has happened in the mental health field as a result of COVID-19 is there are a lot of call-in and web-based self-help and like warm lines that have been coming up and becoming more popular as we are trying to distance ourselves and not spread germs. So I can make available to this group afterwards. There are a whole lot of websites and resources available for people if they're struggling or they feel like they need to talk to somebody. The Michigan Department of Health and Human Services actually has created a few new options. There's a peer warm line that's currently up and running. So peers are people who have lived experience, and it's available for people just to ask questions or, chat about how they're feeling with all of this. There's also the pretty well-known National Suicide Prevention Hotline. There's a crisis text line for those people who would rather text and not talk to someone. The Michigan Department of Health and Human Services has also made a website known as Headspace available for free to people. Headspace is a website that helps walk you through like meditation activities or mindfulness activities. So those are all available, and we can get you the phone numbers and links to those if anybody would like those afterwards, after the meeting. So with that, Barbara, I'm going to turn it back to you and go to our next speaker.
Great. Thank you very much, Lynn. And yes, we will make all of those resources available. Make sure, please, if you have questions, enter them in the box if you have general questions or questions for Lynn. And now we'll hear from Brett Van Tol, who has quite a lot of experience dealing with trauma from Pine Rest. Brett.
Thank you, Barbara. It's good to be here, so thank you. Yeah, I'm Brett Van Tol, and what I'd like to do is kind of take what Lynn talked about and maybe drill down just a little bit deeper with some of that, and talk a bit about what I'm seeing, what I'm experiencing, and that really has to do a lot with sort of the impact of all of these changes. And I think one of the interesting things for me to talk about a bit is how important predictability is to us in terms of our own stress and anxiety level. And when life becomes much less predictable, our anxiety and our stress goes way up. And one of the things that we've really had to deal with, and I think it has impacted people maybe more than we realize, is what do we do with competing information? What do we do when we hear so many different things that we don't really know exactly how to respond? Talking about, for example, masks becoming more important. It's amazing how much it can really stress us or increase the level of, I call it the distress that we feel. Let's say when you walk into a store and maybe 80% of the people are wearing masks, but 20% are not. And you leave that store, and that distress can kind of stay with you a bit. So I think really being aware of and acknowledging the increased level of stress and anxiety we have because of the changes and the loss of predictability in life. We think about predictability in terms of our jobs, but even for the youth that are a part of our community, think about the predictability for them in terms of the loss of school and the loss of daily routines, and the impact that has on feeling secure and feeling safe. I think a second area that's been really, sort of an important area is the amount of loss that we have all experienced. Loss from what has been a normal routine for us, but also loss from our friends and from people that, we can't be close to in this time when we want to feel that support, we want to feel that closeness. So that loss and grief, and sort of beginning to understand how loss and grief and depression can really start to blur together. I think one of the most important things in terms of feeling alone or feeling loneliness is understanding how important it is to know that you belong somewhere. And when we have to start to isolate from each other, when we have to do the social distancing, it can really start to encroach upon our ability to feel like we belong, or that experience of belonging. The other big piece of that is feeling significant. When we're able to pass by those people that we see every day, whether it's in the hallway at work, whether it's neighbors, whether it's go to, a relative's house every Sunday, that adds to a feeling of significance in our life. And we start to do the social isolation, we can take away some of those little but important aspects of life that help us to feel significant. So feeling that loss of belonging and feeling that loss of significance can also really impact symptoms of depression. And then finally, kind of that third area is just the trauma of all the change. Some of the things that I see on a day-to-day basis with people struggling with this change, whether it's in some ways even positive change or negative change, the trauma of that is, starting to feel somewhat detached. When we lose our routine, we can start to feel more detached. But we can see an increase in things like intrusive thoughts, just thoughts, stressful thoughts that seem to kind of come out of nowhere because we have questions like, how long is this going to last? How bad is it going to get? And especially we noticed with the pre-polling question, who is this going to affect? Is it going to affect someone that I love? So all of those kind of worries can create these kind of intrusive thoughts, which also impacts sleep. Sleep is a really big thing here that I think is something that maybe we haven't talked a lot about, but a lot of people struggling with changes in sleep. I've even heard recently from a number of people more vivid dreams that seem to be a little bit more distressful or more disturbing. An increase in hypervigilance. If this big change just seemed to come out of nowhere and it unsettles me, there's sort of this increase in tension, physical tension, and hypervigilance. So we can see sort of increases in all of those physical symptoms of anxiety as well. The other piece, and I won't spend a lot of time on this, but I think we need to sort of address it as well, is the impact of all of these risk factors on suicide and suicide rate, and thinking about the needs that we're going to have, not just now, but over the next several months. Financial struggles, isolation, increased substance use, changes in sleep. These are all risk factors for increase in suicide rates. So as Lynn talked about, there are certainly some important resources that we need to help people have access to help them cope with this. I think also there are some specific groups of people that we need to pay attention to. Older adults who could feel much more isolated now. And the impact of this on children and adolescents, especially if their parents are more stressed. And then, first responders, whether that's safety, police officers, or fire personnel, or whether it's EMT folks, and we'll hear from some of that, and healthcare workers, the increased stress there. I think it's important that we pay attention to that as well and learn to sort of really make opportunities to reach out and connect with each other a very high priority, even if that means learning to do this telehealth thing, again, as Lynn talked about. I think that becomes very important for us to have Zoom meetings like this, where we can all get together and connect. All of those connections help to mitigate and protect us from those risk factors that can increase the symptoms of anxiety, stress, and depression. So, I'll leave it at that, and we'll see where it goes with some of the questions. I'm really looking forward to the conversations. So thank you, Barbara.
Thank you so much, Brett. And yes, please be putting your questions in the chat box, please. We're going to move on to Lee Moordike from Building Resilient Youth. Brett mentioned the impact on our young people a couple of times. So Lee, we invite you to expound on that.
Okay. Thank you. So my name is Lee Mordick. I'm the Prevention and Advocacy Program Manager for Arbor Circle and one of the lead staff for Building Resilient Youth, which is a committee really working to empower youth and those that work with youth to build resilience. And one of the things that really this whole situation has somewhat highlighted with our youth is really the disparity in access. So in some ways, youth are really equipped to deal with this, or our current youth are really equipped to deal with our current situation. They are technology natives. One of my coworkers was talking about her daughter very quickly just rolled with having her friends, like they would be on Facebook Messenger eating breakfast together. And it just felt very, it looks like it's hard to hear me. So I'm gonna plug in my headset and hopefully that helps. So in some ways, you're hearing about youth that are very quickly able to go to social media and platforms like a Zoom to spend time with their friends, to connect. They're probably teaching their parents how to do it. And yet that does create disparities for youth that might not already be connected to their peers digitally, or maybe we're already experiencing some isolation or some bullying, and this really could exacerbate it. It's easy to exclude people online. They also are, the same issues that Lynn talked about with clients not.
You are really coming in and out, Lee.
Our youth may not also have the technology. I do not know how to fix that. I'm at a place with a pretty stable internet connection.
Okay.
So I'm in our office.
It cuts in and out a bit. So
I don't know. The only solution I know is just to ask me to repeat myself. So
you're not going away entirely. It just goes between high and low. So just continue.
Okay. So some of the other challenges though that we are seeing with youth is isolation from those positive adult influences. So isolation from teachers, from coaches, from volunteers, that really are kind of our eyes and ears for knowing what youth are struggling with, and or knowing knowing if youth are at risk for family violence. And so that is a concern. We know that family violence has been increasing during this time, and that increases the trauma that our youth are experiencing. And isolation and family stress is is a really significant risk factor for abuse and neglect. Some of the other challenges, I've been talking to a few of my colleagues, and while youth are able to move to these digital platforms really well, sometimes it's harder to do some of the clinical work we might otherwise do. But what we're wondering is, if someone is just having a check-in, could that be what the youth need, right? So I was talking to one of my coworkers today, and we were talking about, you know, if a youth is in treatment and a parent goes, well, have you used your, you know, breathing technique or your mindfulness technique to handle your anxiety? A teenager is probably going to shoot a snotty remark back to their parent. But a therapist checking in, a counselor checking in, could, you know, will get a much different response from that same youth on those techniques, and how are you coping with this is a much different question coming from your therapist than coming from your parent. And so also I think it's important that we think about the substance use disorder trends that were already present with our teens, and how those play into their mental health issues. So we know that alcohol sales have increased in terms of sales from stores and sales from off-premise retailers. And so alcohol is much more accessible in the homes, which makes it much more accessible to teens. And, you know, when I talk to teens, you really talk about what is not the healthiest, not the best, not the wisest coping mechanism, but what's the easiest. And the easiest is to numb it or make it go away. And so alcohol and drugs do that rather well. It's not good for us. It's not healthy. But so what is happening with our teens in terms of that? And we also know that vaping is a significant issue, and youth haven't stopped vaping. And so that can compound some of this. And some of the early science is actually showing that tobacco use and nicotine use or smoking does play some role in the impact of COVID-19. So I am, though, a preventionist at heart. So I always like to talk about, so what can we do? And really, a lot of what we need to do is connect with our youth, whether that be as a parent, whether that be as a family member, whether that be as a trusted adult. Spend the time having the difficult conversations, look for the signs and symptoms, and ask those hard questions. And then also spend time not asking those hard questions. Make family game night just about the game and not about the conversation you might be able to have. And then really monitoring the technology. I think right now, with how much technology our teens are using just in school, it becomes really easy to just let them use all of their tech all the time in their rooms, and that really can open them up for some risk factors. And then I think as we think about teens, we also have to think about ourselves and really think about what we're modeling for them. And so if we need help, then, or we need, you know, some support, modeling, asking for that help and support makes it easier for them to ask for that help and support.
Thank you, Lee. A good way to wrap that up. And again, please ask questions in the chat bar. We're going to move to Ben and Tim. We have two people from North Ottawa, and I'm not sure which. I've got down Ben going first to talk about kind of first line responders. He is a social worker in ER. So Ben, and then Tim, they're sharing their time. They're splitting their 7 minutes. So I'll let them wrestle over their timing. But Tim from HR kind of focusing on the value of EAPs. Ben, do you want to start?
Actually, we're going to do a little switch on you, and Tim's going to start. My name's Tim Jengle. I'm the HR director here at North Ottawa. I'm the director of human resources at North Ottawa Community Health System. And just also appreciate the opportunity for Noach to be able to discuss such an important topic at such an important time. I did a little research. 100 years ago today, May 11th, 1920, the most popular movie of the week and of the day, Dr. Jekyll and Mr. Hyde. 100 years ago, that was the most popular movie, and it kind of feels a little bit like that to me with what we're going through with COVID. I'm just waiting for the next turnoff to the twilight zone. But I was looking at the definition for mental illness. It's pretty straightforward. And as I read through some of the literature, talked about 1 in 5 U.S. adults experience some form of mental illness at any given point in time. So we kind of wondered, what's the impact of COVID-19 with our employees here at NOCH? And, especially given there's so many unknowns, there's so many uncertainties, what do you believe? People are paying attention to the media. We're getting things thrown at us from the government, our neighbors' opinions, family, friends, etc. At NOCH proper here, we have 650 heroes. You're hearing that term all over the place, and it really is a true term. We have 650 employees here. And those employees are your family members, they're your neighbors, they're your friends, and maybe the stranger down the street, all folks that we care about. And the mission for all of these folks in the healthcare business here has been basically to assure ongoing community wellness. That's been our mission for 100 years. Past behavior is best indicator of future behavior, and we've been real successful. They say that a person's character is revealed during times of trouble and stress. And I can tell you from working with the folks here at NOCH every day, community know that they're strong, they're committed, they're loyal, they're uncompromising, they're focused, they've faced the risks of COVID head on, they've embraced the challenge, and they've maintained the highest standards of professionalism. One of the things that I wanted to look at was what worries people the most. And from surveys and research, 5 of the top 10, we would all guess: work, money, loved ones' health, our own health, and our family's safety. And then again, you look at COVID and all of those things hit. What we're seeing here with our employees in terms of the concerns that our staff have are things like, what if I bring this exposure into my workplace? Or what if I get exposed at work and take something home to my loved ones, to my family? Things like, will my job be impacted? Will I be laid off? How long will I be laid off? When would I come back to work? Folks that are just in general concerned and afraid with contracting COVID. So in general, am I safe at work? Things financial, how am I going to pay my bills? And not only for myself, but I'm also worried about maybe my son who just started a new job, or my daughter whose husband just got laid off. All of these kinds of worries. Or those folks that are dealing with the negative impact of COVID as it relates to graduation ceremonies not being what they could have been, weddings being postponed, not being what they could have been, folks that are worried about the care for maybe elderly folks and their families, daycare issue concerns, we see that quite a bit. And by and large, the biggest concern probably be of our healthcare providers and the support teams is worrying about our patients, the people that we care so much about and take care of every day. So the bottom line is, our caregivers are the front line on this COVID fight and are also the last line of defense. So it's so important that we take care of these folks that we're relying on to take care of us, because if they don't, who else is there to do it? Now, prior to COVID, before we even got down this trail, a lot of our folks come to work every day with suitcases of baggage. Some have financial issues, some have health issues, addictions, marital problems, maybe elderly parents that are sick or dying, children having trouble in schools, maybe being bullied, etc., anger management, depression, grief, all of these kinds of things people are walking in every day trying to deal with, as they're also trying to deal with work and take care of families, etc. Then on top of this, we've got COVID. So even prior to the COVID dilemma that we're concerned about now with the impact on mental illness is the fact that a lot of folks had difficulties before. So does this tip the scales and maybe too far? So bottom line is that employer, North Ottawa, and our community, we're basically one in this. Okay, we are one. We're together, and we got to support together, caring for the folks that are caring for us. And so far, the community's done that. We've received meals for our employees. There's been signs out in the community on people's lawns. There's well-wish notes that we've received, social media praise. Folks have donated face masks. We've gotten gift bags, meals, pizzas. Folks have offered to volunteer. A lot of beautiful things happening. And in addition to that, some things that we're doing as an employer for our folks to help keep them focused on the most important work that we do and that they've been trained to do, educated to do, and they desire to do. We've partnered with groups like Mosaic that provide that mental health support assistance to our employees. And I took a look at the usage. I spoke with folks from Mosaic here this week. Our numbers haven't changed significantly. Kind of thought maybe they would be. It's a typical thing to see our highest spike of people going to Mosaic for counseling and support to be depression and anxiety related. But we haven't seen a real large spike in that. Not sure why that is, and I know that Sarah's going to be talking in a little bit, and she may be able to address that. We've also provided to our employees here a lot of support information on things like Dial 211, the link for Health and Human Services. We've provided mental health warning signs in the resource guide that's put out for Ottawa County. And we've also encouraged a lot of open dialogue with our staff so that they can voice their concerns, whether it be about daycare, just their general fears, etc. And in line with that open dialogue is really support for our management team, our supervisors who are on the front line that have to keep the people motivated. We've also offered things like telework opportunities to support and promote social distancing. We've provided information from the intermediate school district on daycare services. So those folks that we have that may be single parents or folks that have issues with daycare, so they could feel comfortable, I have an option. There's someone there that's going to be able to take care of my children so I can continue to work and care for the folks that I care so much about in the community. We've also looked at things like flexible work schedules to try to be reasonable with folks that may, as an example, have a daycare issue and say, well, gosh, I can't work 8 hours a day, I could work 6, or maybe if Fridays I could get off, then I would have daycare coverage. So we've tried to do those kinds of things. And every day we put out a significant communication to everyone at Noach. It's basically a COVID-19 update on national, state, local news, as well as any policy changes we have to keep our people informed so that they have, again, a comfort level that they know what's going on, what to expect, what we don't know, and we share all those things with them. We also have a daily huddle call with about 30 folks from our leadership team to talk about all the issues that are impacting our facility and our staff and our patients to make sure we're on top of things. We also provide support for employees that are laid off or furloughed to assist them with the unemployment process. It was a little bit involved in a challenge for folks on the front end, and we wanted to make sure that at least people wouldn't have the financial worries of all of a sudden finding themselves not coming into work every day. We've also provided a lot of PPE for our folks here so that they know and can feel safe, so that they're not worrying about, gosh, am I safe at work? And they can focus 100% on taking care of those patients that need us so much. At the end of the day, it's not just about North Ottawa. It's not just the caregivers, the essential workers that are the heroes. It's everybody, absolutely everybody. Whether you're working in a restaurant, a barber shop, at the dry cleaner, or you're a family member at home caring for an elderly person, or you're taking care of children in a daycare setting, we're all heroes together right now. And I wanted just to mention also that this happens to be Hospital Week. Okay, it comes once a year. It's a big time for us here at North Ottawa. So if you see a caregiver, if you see a hospital employee, honk, give them a hug, wave to them, whatever, just to thank them for all the things they do. And I'll leave you with this. People don't care what you know until they know you care. So at the end of the day, that's what we got to do. Is we just got to care about each other. That's 101, very basic. With that, I'll turn it over to Ben from social work, and he can go from there.
Hi, so I'm Ben Eschnauta. I'm the lead social worker here at North Ottawa. And Tim did a great job talking about, kind of what's been going on in the hospital. I really wanted to touch on kind of what we're seeing in the ED as far as mental health goes. So now normally North Ottawa is not an extremely busy emergency department for mental health. However, since COVID kind of started ramping up around here, we've barely been seeing any. So, obviously by the speakers that we've heard tonight, it's out there. We haven't had a lack of cases. There's plenty of people still dealing with the mental health. They're not coming in and seeking out the treatment. So what we've kind of seen lately is that when we do get people into the ER for mental health, we hit almost a brick wall of resistance when it comes to going anywhere to get the treatment. So they're more than willing to come in and get a referral to the Momentum Center or get a referral to Mosaic. But when we bring up going to Pine Rest, even for a partial or for inpatient or to Forest View, it's a brick wall of resistance. Like I said, they're not willing to do it. And that's really kind of handcuffing our abilities to help them with their stuff, because we don't have a lot of options from here besides some outpatient resources, a few other things. And then inpatient is that next step if we can't, guarantee or at least get close to feeling safe where they're going home. So, just make sure that everybody's putting out there that, Pine Rest, Forest View, the psych hospitals, and all the programs are doing COVID testing for their employees, are taking all the precautions, because that's really what we're getting our resistance from is, I know I need help, I want to go, but I'm too afraid that, they're not testing, or that I'm going to get COVID while I'm there, or that, my family can't do any of this without me at home. So yeah, parents are getting very worried about if they leave, well, my kids aren't in school, my husband, my wife can't take care of them all day by themselves. So how am I supposed to do this? I can't go get the help I need because I can't leave my family. Or for kids, my mom can't drive out there every day and come see me because she's got to take care of my brothers and sisters. And, it's not like they can get family to come over and help do that now. So we're hitting a lot of different speed bumps to try and get people to go out and seek treatment. So, any resources that you can recommend for patients that'll help them stay home and get the mental health help they needed. And then just encouraging them to come into the emergency room where we can facilitate a lot of those different placements. I mean, we're getting, I'd say on average in the last month, it's probably a 2 to 3 hour turnaround for inpatient placements with Pine Rest, with Forest View, with Mercy and Hackley. We're getting very quick turnarounds. Everybody's working very hard, very quickly, and they're all doing the appropriate testing to keep everybody safe. But the families just don't know that, and that's really kind of hurting our abilities to help them. So that's just kind of what I wanted to touch on, but thank you guys for having us. We really appreciate it.
Thank you. Thank you both, Ben and Tim. Reminder to enter your questions. And if you aren't seeing that chat button, you might just need to move your mouse around and then that bar will show up at the bottom again. So if you do have questions, just hit that chat and enter them. We're going to move on to Jody Sprague, who's going to talk about suicide prevention. Jody.
Hi, thanks for having me. My name is Jody Sprague, as she said, and I'm from Spectrum Health. My role is a clinical program specialist for suicide prevention, and we work hard to train hundreds of people in Ottawa County and thousands of hospital and physician office workers to know how to respond if people are getting into a mental health crisis. And we want to, like every other diagnosis, we really want to get ahead of that. We want to be able to catch it when it's smaller and not a crisis, just like I would if it was diabetes and I want to catch it earlier, or if it's cancer, I want to catch it when it's really small and it's easier to work with then. So part of my role is training healthcare workers. We're looking for every way that we can to help our communities to address mental health. And so we're also, we have Spectrum Health. We are in 16 different counties, and we have social workers in the physicians' offices, and they are in most of them. And they are ready to help if there's if that comes up in the doctor's office. We're also working with schools in the area, trying to make sure all the teachers know how to respond when people are thinking, particularly if it moves into a place where they're moving into suicide and crisis. So as part of what we're doing, which is a big job, but we're really, as you can hear through all these speakers, we're really trying to help make sure that the word is out there, that we are doing everything possible, collaboratively working with all these different agencies so that we can get people help where they need it, when they need it. If they're not coming into the ER, then we want to be able to get them, as the very first speaker spoke about, getting crisis mobile, where they're going to go to the home, or we're going to get a virtual where you could talk to people on Zoom. Some people are very comfortable with that and love it, and other people feel a little bit nervous about it because they can't find privacy. So I did put together just a couple of things about, I'm going to see if I can share my screen, about suicide prevention. Let me see if you can see that. Can you see? Oh, here, share. Nope, that's not what I wanted. Now how do I go back?
It's there. It's there, Jody. We can see it.
This is a suicide safe though?
Oh, preventing crisis.
Oh yeah, okay, that's what you can see, perfect, okay. Yep, that's what I wanted to do, was to prevent crisis and warning signs. Let's see if I can. Oh yeah, I'm seeing it, I'm just not. Oh, there we go, it started to move for us. It's just taking a while. Sorry about that. So what I really want to express to you is that we want you to keep your eyes and your ears open if you're in home. We're in places where we usually aren't. We're working from home, or we're not working at all, or our kids are home. So we want people to be the eyes and ears for that. And let's see, this isn't advancing very well. And what we want you to be able to do is look for some of the warning signs. Some of that's been mentioned earlier, but if you're not familiar with this, some of the things that we're seeing is some inability to cope with daily things. And this can be our elderly parents, it can be our teenagers, it can be our spouse or our neighbors, or whoever we're with. Some of those rapid mood swings, or sometimes getting agitated or irritable quickly. Feeling really isolated, where people just aren't coming out of their rooms, can be really concerning as well. So we're looking for some of those pieces. Oh, I see. There we go. And then some of the risk factors. Someone mentioned some of those earlier too. We just wanted to talk that oftentimes when we see people who are in crisis, it's not one thing. It's a perfect storm type of thing where it's coming up later, but it can be relationship problems, or it can be substance abuse. People are using more substance abuse. Physical health, of course, with some of that. The people who are getting sick or have chronic pain can really struggle with some of that. Job loss and housing issues, finances, that can also be concerning for people. It's often not one thing, it's a combination of other things. And again, we want to be able to catch that before it moves into a crisis and moves into that perfect storm where everything is just coming at us there with that. So this is just not moving for me. So what we do is, I just wanted to mention, we also train and teach people about balancing it between a protective factor, those risk factors that are out there, but also the protective factors. What can help us stay out of a crisis for that? And some of the protective factors are staying connected. That's probably one of the biggest things that we can do in having caring conversations, whether it's our employee or our kids or our relatives. You can see some of these protective factors here, and helping our friends and our family get connected if they're not connected. So in Ottawa County, we have a newer piece of this, and we're going to talk a little bit more about this later, but I've got a snippet of it. The first thing I want you to do is think, are they in immediate danger and they need to go to the ER like the person just spoke about? Then let's get them there. We have some resources for you here. If it's not immediate danger, but there's other things going on, you can call that 211, or you can call community mental health. There's people who are available 24/7. I don't care if it's 11 at night or 3 in the morning or 9 o'clock in the morning. Also, you can call 211 if you're just looking for a counselor and it's not urgent, but I really think I need to get somebody connected, or myself, I need to get myself connected. So these are just some of the things that we can offer. And then the last piece that I would just end with is that we really encourage you to be alert and be the eyes and the ears for others as well as yourself, and then connect people to hope that could save a life, really. So with that, I'll stop sharing and send it back to you, Barb.
Okay, Jody, thank you very much. And yes, we will make sure that all the materials that are being shared tonight are available and that we're getting them out to everybody who's involved in the town hall. Rest assured of that. And now to kind of wrap up our conversation with our panelists, Sarah Lewakowski to help us with ideas for managing our mental health right now.
Hi, everyone. Thanks so much. I'm so
You just cut out, Sarah. Oh.
okay. I am the executive director of Mosaic Counseling, formerly TCM Counseling. And as some people have mentioned, Tim for North Ottawa and Ben at the hospital, we definitely saw a decrease in the number of people coming in initially when there was a stay-at-home order, because all of our therapists started doing teletherapy, and I am attributing this to some things that Lynn also said, that people might not just have the access, they don't have the computer to the equipment to do that, but then also the time or the space in their home now that kids are home. So to find a place that's completely confidential for 50 minutes has been tough. We are expecting that once people can go out again, that we'll have a pretty big increase in the number of people coming in. And then also once kids go back to school, we're also expecting another increase at that time. I do have a presentation, a brief presentation, but I just want you all to know, if you remember one thing about Mosaic Counseling is if you live, work, worship, go to school in Ottawa County, we will not turn you away. We have over 75 therapists. So now I'm going to start my presentation. All right. So I'm just talking a little bit about anxiety and stress right now. So we are all experiencing this all together, and it's causing anxiety and stress in adults and our kids. And it's important to know that this is normal. And it's also important to know that everyone reacts differently to stressful situations. And everyone also has their own unique relationship to this situation. So some reasons for maybe responding more strongly, maybe being in a higher risk category, being an older adult, having an underlying health risk, maybe a healthcare provider, first responder, or the essential workers that are working right now at our grocery stores, at the post office, or people who have a mental health condition, or people who have issues with substance abuse, or children and teens. And so anxiety and fear might include fear and worry about the health of yourself and your loved ones. And we saw that on the survey that Barbara did right at the beginning. Maybe changes in sleep or difficulty sleeping, maybe a hard time concentrating, changes in eating patterns, worsening of chronic health issues, or self-medicating with alcohol, tobacco, other drugs. So coping and supporting for yourself, take control. You know, that's the one thing that I think about a lot. We have had control taken away from us in many different ways. But what are some things that maybe we can take control back? Taking breaks from watching and reading the news. Because if we repeatedly hear about COVID-19, that can be really upsetting. It can be scary, and it can also cause some hopelessness, especially when we hear that, you know, the stay-at-home orders are extended, and then they might be extended again. We don't know what's going to happen in the fall with going back to school. paying attention and taking care of our body. You know, it's simple, but it's so powerful. Just deep breathing, praying, meditating, stretching, yoga, whatever is right for you. Eating healthy and helping boost your immune system. Getting plenty of sleep and exercise, and while socially distancing, make a point to socially connect. And then journaling. If you've ever been in counseling, a therapist may have recommended journaling to you. You know, we can have a lot of thoughts bouncing around in our heads, but you can only write one word at a time. And so journaling can be very, very helpful. So what do you have control over? Your immunity. And your immunity helps if you were to, unfortunately, contract COVID. Diet and exercise, vitamin C, getting outside, discovering a new place to walk. We have so many beautiful trails around us. We're so lucky. Somewhere where we can walk and socially distance. And then you have control over being a helper. If that's something that would really provide you something that, you know, therapeutic, sewing masks, virtual tutoring. There are a lot of kids at home right now that are struggling because they don't have their teacher during the day, every day. Food drives, shopping for an elderly neighbor. And reframing, trying to reframe a crisis into an opportunity. So changing the focus from things that you cannot do into things that you can do. And then the power of positive thinking. So according to Mayo Clinic, positive thinking actually can increase our lifespan, lower a rate of depression, lower levels of distress, greater resistance to the common cold, better psychological and physical well-being, better cardiovascular health and risk of reduced death from cardiovascular disease, and better coping skills during hardships and times of stress. All of these things would be helpful right now. And then briefly, I know Lee already talked about it, but helping our children and teens, some things to do, because that's one of the calls that we are getting quite a few, are parents calling for their teenagers. So first, starting with our own anxiety. If we're a parent in the house with children and teens, they hear what we say. They take the lead from us. So they hear us talking to other adults, talking on the phone. So being mindful of what we're saying to other people, being mindful of how much exposure they're getting to the news, especially if they're getting exposure to it, but then we're not having any discussions about it. Do take the time to talk and answer questions and reassure their fears. Try to keep regular routines and model healthy habits. And teletherapy is available. We probably get a call or an email every day. Are we doing teletherapy? And here are some resources. So here's our phone number, put Arbor Circles on here, Pine Rest, Community Mental Health's access line and their crisis line. And then, but if you know someone who is suicidal, please call 911, or they should go to their nearest emergency room. Or Pine Rest and Forest View have both said that they will see people if there's too much activity and stress in the emergency room. And then some other resources. Lynn mentioned this, and I put it in the chat message that I had them all on a slide. But there they are, and Barbara said that she would also send this to everybody as well.
Excellent, excellent. Thank you, Sarah.
Thank you.
Really, thank you to all of the panelists. One question came through about whether people are serving Latino and Hispanic population and whether there are translators. It's my understanding that the places that are serving those populations do have translation and interpretation services. If there's a specific agency that you're asking about, please type that. And I see that also Mosaic has Spanish-speaking therapists. CMH has interpreters. What I'd like to do is go into the breakout rooms, and we're going to ask fewer questions. We're only going to ask a couple because we have had such a really necessary time hearing from our panelists, and we don't want to run too late. But I am going to put you into breakout rooms, and what's going to happen is you're going to be randomly assigned. I have into one of 10 groups. There are 10 people who are acting as facilitators, and there's no way to do both a random and assigned, I found out. But you'll all be randomly assigned, and then your facilitators are going to check and see if there's more than one facilitator in the group. And if they are, they're going to opt out of that group so I can reassign them. So there might be about a minute of juggling around people. During that time, the first question is just to introduce yourself to the people in your room and share why you're participating in the town hall tonight. So we're going to do that, and then I'll have a couple questions about resources and gaps. We'll come back to share what each group identified as additional resources that maybe haven't been mentioned, and also as gaps and needs in our community. And then we'll ask, after hearing about those gaps, if our panelists have just a minute that they want to kind of wrap up and address things that were shared. So I'm going to hit the button to send you into rooms. And I will see you soon. Hi, Jenna. Was there somebody else in yours? Oh, Lee is in there. You're still on mute, by the way. Let me find one to put you in. Okay, I'm sending you to 7.
Okay.
2, 7. So I gave you an invite for 7, but I think you have to click it to go there. And Callie, I'm moving you to 8.
Okay.
As soon as I find you again, there you are. 8. And then you'll have to accept that to go. Jessica, Jesus, all the staff people, huh? 9. Who else? Oh, Neil, Rebecca was in that. Okay, I'm sending you to 10.
Okay.
Belle, some of these got big and some of them got small. Uh-oh, where did you go? I lost you. There you are. Move to 10. And then go ahead and accept that.
I don't see a thing to accept.
No? I'll try it again. Oh, it says that I've moved you there. So there should be, huh?
Are we in 10 right now?
No, I'm not in any. You should, it says you haven't joined yet.
Let me put this screen down and see if. Yeah, there's nothing there.
Well, I'm going to move everybody in 3. There's only 2 people in room 3, so I'm going to move them to. I should tell them that though. Yeah, I don't. It says that you have not joined, so I don't know.
I mean, usually it pops right up and there's nothing there.
Well, I'm going to go into 10, and I'm going to try moving you to 3 then.
Okay.
But, and if you won't be the only facilitator, but there's only like 2 people in there, so.
Okay.
Did you get one for group 3?
No.
Okay, it shows here again that I moved you and you haven't joined. So maybe.
Oh, here we go.
Okay.
Okay. There you go.
Hi, did one of the groups come back?
I thought I saw your message just at the top bar. I couldn't see it in the chat.
Oh, so the question was, how are you, what are the resources that weren't mentioned tonight? What are things we can do? And are there other resources that weren't mentioned? And I said to take 5 minutes. So 3 more minutes on that.
Okay,
And then I'll send another question.
perfect. Okay, so for my group, there's breakout rooms on the bottom, about 2 away from the leave button. Click join breakout room and we'll meet back up in the breakout room.
Then what breakout room were you in? Oh, 8. I'm gonna send you back. Click, then there's on the bottom, there's a thing for breakout rooms.
Oh, join breakout room. I see.
There you go. Go ahead and stay in your room. Oh, you got So I take it this is one group that came back? Or is this more than one group? Group 4? You're all group 4?
I think we're group
It
one.
was 4 from our group.
Okay. Okay.
Came
So
back.
you answered the one question already? Is that why you're?
Yes.
Okay. I'm gonna give a second question, just because we're running out of time. We're not gonna be able to check in on both. So so if you go, well, I can tell you the question and then I'm gonna broadcast it to everybody. But that question is, what else can we do as a community? So the first one, of course, was what else can we do for ourselves? What resources are you aware of that maybe weren't mentioned? And then the second one is, where are there gaps? What else can we do as a community? So if you go talk about that, and then I'll warn everybody that the group is ending, so we'll all come back together.
So how do we go in our breakout group?
If you go to the bottom, if you scroll, there's 4 boxes that say breakout rooms.
Just go right there?
Yes.
Okay.
Just join your
All
room
right.
again.
I'm learning. So
We're all learning. So I'm sending everybody back to their rooms for the last question. Okay. And last question. Breakout rooms. should have definitely been stopped recording. Okay, let's see. Jody. Brett. Lee. Tony. Sarah. Lucy. Kelly. Rebecca. And okay, everybody should be back with us, those that were able to stay for this part of the town hall anyway. So what I'd like to do now is I just want to go to each, a facilitator in each group. There might have been 2 facilitators in a couple groups, but I'm just going to call a name. And if you could unmute yourself and share a very short summary of resources that maybe hadn't been named yet and concerns or gaps that we still need to address, and try not to repeat everything that other groups have already said. And again, just in the interest of time and wrapping things up. So first, Jody Sprague.
Oh, I'm glad I get to go first, then we don't take all the answers we have, right? I'll just say one of them that we talked about, we spent some time talking about students and feeling like people aren't reaching out to them. They're kind of being asked to call in and do some things. So there was some information about that, and those that don't have computers and maybe have computers or a phone, but they don't have access to the connectivity of it. They don't have internet services at home, and they're feeling really just wondering what to do. So there was an example of like even someone who's going to be a senior and just doesn't know how to proceed from here. So they're feeling left out. So it'd be good for us to get some of that information out. We're hearing about it tonight, but it'd be good to get it out to others that they don't know about it.
Yeah, excellent, excellent. Thank you, Jody and Group 1. How about Break Room 2, Brett?
Yeah, just to add to that, I would say a couple things. One is the technology needs for individuals that do have special needs, or for families who have students with special needs, that, you know, maybe just a computer and internet, there may be some more technology that's needed in addition to that. And the other thing is for parents, just the stress that parents have trying to be the teachers for their children. Are there resources? Are there, crash courses or trainings that we could maybe provide just to give parents some basic tips and tools of, how to be their children's teacher a little bit, or provide an environment that the kids can learn it. Yeah.
Excellent. Thank you, Brett and break room 2. How about Lee and break room 3?
Sorry, that took me a minute to unmute myself. So the resources that we talked about that are different is the Parent Coalition for Building Resilient Youth put together a postcard list of virtual recovery groups. So Barbara, I will send that to you so that you can share that out. And then the gaps that we really talked about was really really kind of repeating some of that. Kids, how are we connecting with kids, especially like the elementary students or the school age but young students? How are we making sure that we're reaching them, and then connecting with the hard to connect with families, like the families that Health and Human Service workers might already be concerned about, that it might be hard for them to call us back. What are we doing to really connect with them? And the other gap that we really talked about was knowledge that resources are open. I think there's a, everyone's been talking about like the stay-at-home order and everything's been required to close, but do families that don't have a staff person in the Health and Human Services world, do they know that we're all still providing telehealth?
Yeah, excellent. Yeah, getting the word out even about what we've shared to people. Thank you. How about Lynn in break room 5?
So a couple things have already been mentioned, but some resources, parent virtual group meetings like support meetings was mentioned, and Arbor Circle, like Lee just said, has some resources available. One of our folks who's out at Coopersville schools talked about Be Nice blasts. So each week they send via email a topic for students to talk about and discuss and think about. I think probably the gap we came up with, the greatest gap is how important it is to stay connected, but really how it seems lately like the way to do that is via the internet, and not everyone has access to it. So what a wonderful thing if this county could be internet access for all.
Yeah, excellent. Thank you. Sarah in group 6.
So we really talked about also getting the word out and communication and all the different ways that you need to do that. But ours also focused on that was different, so that people who are experiencing anxiety or depression, that they know that they're not the only one feeling that way. How common that can be, even though, there's so much information out there, that people still can feel very isolating and think that they're the only person who's feeling that way. So helping to get that word out.
Yeah, thank you. Thank you, group 6. How about Lacey in group 7?
Yes, just a few things to add. A lot of our group got on the town hall to try to find more resources for the clients that they serve. So there are a lot of resources out there, but kind of trying to navigate those resources and knowing where to distribute them and how and when is at the right time. So we talked about trying to find balance in that, and that knowing that one thing is a good thing, and to keep kind of rolling with it. One good piece of advice that was shared was taking your own advice that you give other people, because sometimes it can be hard to do that yourself. And that things have gotten almost a little bit more chaotic for those who are still kind of working online and trying to make that work. So taking short breaks. And then finally, this is kind of thinking further, maybe beyond COVID, or as it progresses further, and just knowing that like transportation and technology issues are going to continue and access is still going to be here. So maybe applying some of the things that we're doing now longer term, so that we can continue reaching areas of the community that we haven't before.
Yeah, so there could be a silver lining in some of this, and discovering tools to reach more people. Thank you, Lacey in group 7. How about Callie in group 8? Oops, you're still muted.
Sorry about that. Most of the things have kind of already been said, but transportation, I think for folks that you know, have limits or restricted budgets, maybe food banks, or you know, a lot of the food trucks are doing drive-through, but if they don't have a vehicle, what does that look like?
Good. Thank you, Callie. Thanks, group 8.
Okay,
and
now
Rebecca,
you're muted, Miss Barbara.
and Rebecca in group 9.
Hi there. So similarly, a lot of these questions were answered, but a lot of same thought processes. But a lot of our grouping entailed again individuals looking for resources for their clients, and kind of just express the use of the chat bar for that, and just how the Momentum Center kind of serves as that purpose as well. In fact, it was kind of interesting because a lot of these individuals are people that have never come to one of these meetings. So just, again, seeing that silver lining that comes with these types of virtual events. You know, we spoke to the dynamics of exhaustion because of, you know, whether parents or professionals, just kind of integrating new concepts into their workforce and or parenting. And just kind of what that new reality looks like. We kind of touched on like the slowing down process and understanding the needs versus the wants in life. Someone spoke to home cooked meals over feeling the need to stop in this grocery store a few times a week. And so I feel like those were a little bit of the silver lines that came with our situation, but kind of obviously recognize, you know, the disparity of technology and how that has always been a consistent conversation as far as mental well-being and the negative effects it tends to have. And so now that this is in front of our children, you know, all the time, we can't question that, you know, this is a concern of ours. So yeah.
Excellent, excellent. I do know that as comments were made, people were writing in the chat. Angela listed resources from the ISD for parents. Amy listed some additional suicide prevention documents. Angela again came back with some other parent resources. So we will make all of that information available, all of the slides, the recording of the conversation tonight. I do have a couple of ending polling questions I want to ask, including whether you would be interested in another town hall and what particular topics. But before I do that, do any of our speakers want to share just a last word, a last thought, having heard the feedback from the groups? And just so it doesn't get kind of chaotic, I'll name you, and you can kind of raise your hand or unmute right away if you want to. You can all unmute yourself and then let me know if you have a final word. Lynn, would you like to share anything?
No, just thank you so much for hosting this, and great conversation, and thanks for everybody's participation.
Thank you, Lynn. How about you, Brett?
Yeah, I would just say, you know, it's awesome to sort of have this connection, and connection, I think, is going to be a key moving forward. So yeah, Momentum Center can really, I think, be a hub for a lot of that connection. That's perfect. Yeah.
Great. Thank you, Brett. How about Lee? Any final comment?
No, just thank you, Barbara. I think someone mentioned parenting classes. So Arbor Circle has moved all of our parenting classes on to virtual classes. So I'll send that information to Barbara as well. We're putting them up on our Facebook page under events, so that seems to be the best place to refer you. But as I think about parents, just a reminder that what worked yesterday when there wasn't a global pandemic might not work today, and that's okay. It's about really paying attention to the needs of your kids.
Absolutely. Thank you, Lee. Ben and Tim had work that they had to get to, so they had to leave us early. Jody, anything you want to leave with?
Yep, I just feel like I want to represent one person brought up when we were talking about things that would be nice to have that we didn't have in our county. And that is also just paying attention to the disabled with particularly wheelchair and physically not being able to get places and also not having internet access and feeling extremely isolated. So I just wanted to make sure that I didn't hear anyone else mention that. So let's put that on our list.
Thank you. Thank you,
Thank
Jody.
you.
And Sarah, anything you want to close with?
I just want to say thank you again, and this has been a great conversation. It was nice meeting the people in the breakout room. I just want to say a lot of people are feeling hopeless, and anything that we can do to the people that...
Oops, you cut out.
Oh, anything that we could do for the people that we connect with, just to help them with hope, would make a big difference.
Mm-hmm.
Absolutely. Absolutely. Thank you. I'm going to throw up a poll question here just about whether you found this helpful at all. Was it helpful? Did it make you more aware, motivate you to action, or convince you to continue or lead as an advocate? So just take a quick minute to answer that. Oh, I missed a group sharing out. I apologize for that. I don't know quite how I did that. But my apologies, Angela. I have you down, I just didn't ask you. So I'm gonna end this polling and show you. Yeah, it looks like it was certainly beneficial to people. So I'm really glad we did this. And Angela, do you want to just report for your group quickly, group 4?
Well, I just wanted to make sure that you had that specific feedback that someone in our group mentioned, that it would be helpful to provide language for people struggling with anxiety and depression, because it can be hard to describe the symptoms. And we do a really good job helping to provide language for people in supportive roles, but not always for people who are trying to self-advocate.
Yeah, that's excellent. Thank you, Angela. And my apologies to break room 4.
It's all good.
I have no idea how I did that. And here's the last polling question. Oops, I need to stop sharing first. And this is about a second town hall. So there's 2 questions. Would you be interested in participating in a second town hall? And if so, what topics would you like to see addressed regarding mental illness and COVID-19, but some also more specific topics? So I'll let you go ahead and answer that. Hopefully you'll all answer. We'll give it a few more seconds. We're at about 82%. Make sure I give everybody an opportunity. Make sure you hit the submit button. If you answered it all and didn't hit submit, I won't get those results. Couple more seconds. Okay, so looks like we definitely have interest in another town hall. So that's very, very good, very encouraging. I am very grateful for everybody's graciousness with me learning a new platform. Helpful feedback here on topics. Looks like particularly alternative therapies, adverse childhood experiences are ranking really high. Again, We will take all of this to the mental illness task force to kind of digest and bring the people to the table who need to be part of a larger conversation to address these community gaps. I'm so grateful for your participation, all of the panelists, all of the volunteers, and our sponsors, the county, the city of Grand Haven area schools, and North Ottawa. Thank you so much, truly from the bottom of my heart. My closing words are simply to please practice physical distancing, but stay socially connected. We really do need to be connected to each other. Stay home, stay healthy. And until next time, namaste.